Patients go to an infertility specialist and often are asked many questions. The infertility specialist shoots them with a lot of questions and answers, and the patients get irritated. Why are they asking me so many questions? How it is related to my problem? So namaste everyone. Here I am Dr. Leena Yadav, and I want to actually tell you that what question is relevant and why do we ask them, and how does it help us to understand about your profile. So, first of all, I ask my patients what is their name and what is your occupation. Now, what is my logic behind asking them their occupation? The occupation is asked to a female and a male partner to understand that how much time the couple spends together. IT professionals, business analysts, economists, high-profile people, architects, they have got very limited time with their male or female partner together. That indirectly helps me to understand that if they have been trying for having a conception, why they are not able to conceive. Maybe they are not able to give enough time to each other, or maybe they are not able to plan a pregnancy during their fertile days. And then what do? I actually tell them that these are your fertile days and please take time out with both of yourselves to have a intercourse. So this is the importance when I ask anybody that what is your occupation, how many hours of sleep do you get, how much time do you spend with each other in a week, maybe in a fortnight or in a month, because there are some people whose partners are traveling, they work abroad, they are not there with them during the fertile days, and that is how we guide them that when they should be around. The second common question which we always ask patients is about the age. The age of the female partner is not the only one which is important. The age of the male partner is also equally important. Now, how does age matter to us? Oh, it is a very important parameter. It shows us your biological clock. It's important, very important for a female partner, and yes, equally important for a male too. When we ask a female about her age, we actually try to understand that if she is above 35 or she's in her late 30s, then what kind of treatment plan should we advise her? Whether should we tell her to still try on her own, or should we make her egg what we call as ovulation induction with medicines and tell them to have an intercourse, or we should go a little more aggressive by trying IUIs, or if the lady is at an advanced age in her late 30s, then we might straight away tell the couple to go for an IVF treatment. Because the later you plan the pregnancy, the more problems, the more health issues a female partner can have. Obviously, in some people, you might also get some problems in the gamete quality of a couple, problems with eggs, problems with sperms when you are at an advanced age. It's not necessary that the marriage has happened earlier. Maybe you are just married for 6 months and I might straight away tell you to go for IVF. I know it annoys you, but you know why? I'm telling you to do that because we have got very limited time to work on you. We have got very limited time to help you conceive. We want you to conceive faster so that you should not have health issues. The baby should not end up into preterm labors. The baby should be delivering on maturity at 9 months. There should be no preterm deliveries. Yes, I'm trying to tell you the complications which we might face when we plan advanced age pregnancies. So that is the importance of the age. The male partner, advanced age does not play a major role, but yes, the sperm quality gets affected as the age approaches. With advanced age, the male sperm is proven to have genetic defects, some DNA abnormalities for which we have to aggressively screen them before we plan any kind of fertility treatment. So with these two things, occupation and age, we get so much of knowledge. After that, I always ask you how much the time when you people are married to each other and for how much time are you planning a conception. It's just a simple question. But you know how much information does it give me? It tells me that if you are married for more than 2 years, trying for more than 2 years, people tell me that we were trying immediately after marriage. Some tell me that we were using contraception and we have recently started planning. Some tell me that we are just recently married and we don't want to plan a conception. Now here, the doctor decides a lot of things. If you are a couple with advanced age, the doctor might tell you that there is no time which you can waste in planning a fertility. Please immediately try, and the doctor will guide you step by step how you have to try each menstrual cycle. There are steps. The doctor might get your day 2 tests done, then they would evaluate you on the ultrasound, then they will tell you when to have an intercourse together so that you do it on the fertile days. If you are a person who's married for 2 years and still in early 30s and trying for 2 years, the doctor still has some time to work on you and to tell you that, okay, let's plan ovulation induction for you and then let's make your egg, and then I might tell you that you should plan your intercourse during these days of your cycle. So the whole plan of action changes when we discuss married life with a couple. We discuss for how much time a couple is trying to conceive and for how much time the couple had initially been using any mode of contraception and not able to conceive. So this is a series of lectures which I will be telling you each and every question, that why does the doctor ask you all these things? What exactly these things tell us about you? In this video, I have discussed with you what is the importance of your age, what is the importance of your occupation, what is the importance of your married life, and indirectly, I have also tried to tell you that what is the importance of using a contraception. Barrier contraception is fine. But when females tell me that we have tried using copper teas or we have tried using pills, oral contraceptive pills, or we have tried using diaphragms to, avoid our pregnancy, that is where I get an alert. OC pills, if taken for a medical cause, are okay, but they definitely have some impact on the normal functioning of the ovary if you take them more than 6 months. Some people recommend that you should not take oral contraceptive pills for more than 3 months at a stretch. If you are taking oral contraceptive pills for more than 6 months at a stretch for avoiding a pregnancy, I would rather recommend you to keep some days off in between before you again start another cycle of contraception to avoid a pregnancy. So by that I mean that if you are taking an oral contraceptive pill to avoid a pregnancy, take it for 3 to 6 months and then give yourself and your body a gap of 2 to 3 months before you again try to use it for a contraceptive purpose. In those 2 to 3 months, the axis of your brain, which is important for the normal functioning of the reproductive system, might again come back into action and the hormones would again try to release naturally as what they want to do. Because when you use these contraceptions, you are actually subsiding your body not to produce hormones, not to produce certain kind of stimulus. For a limited period of time, it is okay. But if you are using these methods for longer periods, more than 2 years, 3 years, some people use it for 5 years, then it might indirectly suppress your body to some extent and which might later have some fertility implications. So thank you so much. Please listen to these series of video to understand that when do you go to a doctor and that doctor asks you the history about multiple things, what actually the doctor is trying to understand so that they plan and formulate a perfect treatment for you. Thank you so much. See you soon.